This is RTV6 News at 5:30, working for you.
And now at 5:30, Call 6 investigates and covers a healthcare system is closing facilities and laying off workers after receiving millions in stimulus money. Why some say their clinic could be saved. Dan.
Here's what we're talking about in our lineup today. As the number of COVID-19 cases grows, we're looking into the likelihood of a second lockdown. And we're clearing up the confusion about messages going around social media that you have a COVID-19 tracking app on your phone now. Also, we're starting to see a new trend in some home sales where people are choosing to leave cities for the suburbs and what's driving that change.
And first at 5:30, hundreds of employees and patients are being left in limbo as Community Health Network announces it will close 2 Kokomo facilities, an outpatient rehab clinic and a specialty hospital. Call 6 Investigates has uncovered the closures are happening despite the healthcare system receiving hundreds of millions of dollars in federal stimulus money. The rebound is our commitment to making sure the systems in place to help Hoosier businesses are working as they should. Our Kara Kenny joins us now with why patients are confused and concerned.
Good job! So big!
William Hartman's 16-month-old daughter Kinsley is getting help standing and walking at Replay, an outpatient rehab clinic that's been in Kokomo for 30 years.
She has come a long way.
William just learned Community is closing Replay as of August 30th, as well as Community Howard Specialty Hospital, which offers both inpatient rehab and outpatient therapy.
So we were kind of surprised that, where did this come from? Out of nowhere.
At least 120 workers will be impacted by the closures and hundreds of patients like Kinsley and Julie Howard. She's used Replay for years for shoulder, back, and neck problems.
I was shocked, upset, angry, confused, a lot of different emotions. Why is this facility going to close? It's busy.
Both say COVID-19 prompted Replay to only open on Mondays and Fridays.
Only 2 days a week were open. We had to wear a mask.
Community Health Network's decision to close doesn't mention COVID. It says they made the call after a thorough evaluation of the needs of this community, the changing landscape of healthcare, and how to best align Community Howard Regional Health Services to sustainably meet those needs both now and in the future. The closures come as the Federal CARES Act and other programs provided $175 billion in relief funds to hospitals and other healthcare providers on the front lines of the coronavirus response. Call 6 Investigates found Community Health Network received $85 million in grants and $133 million in federal loans, among the highest recipients of Indiana companies.
That just doesn't seem right. It just is very frustrating.
From what I thought, the federal stimulus money was to prevent employee loss.
Community Health Network hasn't responded to our questions about how they spent the stimulus money, but they did say the CARES Act funds can only be used for COVID-specific needs. The Department of Health and Human Services has strict guidelines in that regard. So we did some checking and found healthcare providers do not have to spend stimulus dollars on treating the virus. The grants can also be used to offset COVID-related revenue losses caused by things like fewer outpatient visits. And the money can be used to cover payroll, rent, mortgage, and other expenses to keep a provider's doors open. We asked healthcare expert and law professor Seema Mohapatra to review the federal guidelines as well.
This money was really supposed to help support the industry at a time of emergency. So any lost revenues that are at all related to COVID. And so that could be the fact that you're not seeing as many patients, that you're not actually being able to do elective procedures, you're not able to have outpatient procedures.
Mohapatra says healthcare systems look at a variety of factors when deciding whether to close facilities.
It could be just a strategy of the system and what they've decided to. And as a private entity, they're able to do any of that.
Replay's patients are heartbroken.
Other kids with disabilities are going to be impacted. I cannot tell you how well of a ran facility this is and how well they treat you.
They'll have to get care somewhere else while employees are left in limbo. They wonder if millions of stimulus dollars could have saved these facilities.
And I really feel that there has to be a way, if they dig deep, that they can save one or both of these facilities.
Kara Kenny, RTV6.
Kara, thank you. And 121 people will be laid off from the facilities, according to documents released this week. 85 at the specialty hospital and 36 workers at Replay Clinic. Community Health Network says, quote, current patients at both facilities will continue to receive the same level of high quality, compassionate care. You can read their full statement in this story on the RTV6 app and on our website. And we reached out to the U.S. Congressman for Kokomo. Representative Jim Baird told us, quote, our office continues to monitor that the use of taxpayer funds are used accordingly to the CARES Act. If adjustments to the rules and guidelines are needed, our office will work with the administration to provide the necessary flexibility. Kyle.
Yeah, you know, the last couple of afternoons, we have had some heavy downpours across central Indiana. That is not the case today. Storm Team 6 radar showing us we've got just a couple of very light showers now in central portions of Hendricks County, and even those are quickly fading away. So I think most areas are going to be dry. June actually ended up above average, although it was a fairly dry month overall. We picked up about half of our rainfall total for the month in the last 5 days across central Indiana. So things are certainly trending in a drier direction. Looks like the next few days you're not going to need that umbrella, and then rain chances only about 20% Sunday and Monday. Temperatures, they are still steamy out there. We've got heat index values in the lower 90s with temperatures in the middle 80s. We'll talk about a steamy forecast as we go into the holiday weekend in just a few minutes. Dan?
Health experts are raising concerns about the U.S. government's move to buy nearly the entire global supply of remdesivir. It is the only drug licensed so far to treat COVID-19. They say this creates a dangerous precedent for attempts to share scarce treatments amid the pandemic. The Department of Health and Human Services says President Trump has secured 500,000 treatments of the drug through September. That's 100% of Gilead's July production capacity and 90% of its capacity in August and September. And we're learning more about different treatments that can help with serious complications associated with coronavirus. Both adults and children that get the virus are at a significantly increased risk of developing blood clots in all of their organs. Doctors have been treating with a medication to prevent the clots. The problem is they don't know how much is safe for kids.
And there's a bunch of data to say it works and it's safe at specific doses. In children, there's none. We just wing it. And that's not okay. I think we need to actually demand that we answer that question a little bit more carefully.
That's where Johns Hopkins All Children's Hospital comes in. They've teamed up with other hospitals to study how to best use these anti-clotting medications on kids who not only have coronavirus, but that secondary virus-related issue, severe multisystem inflammatory syndrome. Thankfully, the children Dr. Anthony Soche has seen have recovered well from both COVID as well as MIS-C. But he reminds us another virus season is right around the corner.
And I can't tell you, every single year I take care of critically ill, dying children from flu. And it's such a shame. It's just a shame. We owe it to ourselves to protect our community and our children.
The anti-clotting medication study in children should only take a few months because of the collaboration with other hospitals. And a big business group is now calling on Congress to pass police reform. The Business Roundtable, which represents the CEO of nearly 200 large companies, says it wants to see action before Congress's August recess. The group is calling for a ban on chokeholds, except when deadly force is warranted, a national police misconduct registry, as well as higher standards for the use of no-knock warrants, among other changes. And checking on our lineup, there's talk of a new type of testing as we see more COVID-19 cases, how pool testing works, and where it could be used. Top health officials are considering pooled testing as a way to ramp up COVID-19 tests. Here's how it works. Instead of testing each sample individually, labs pool together a certain amount, like 10, in one tube with one test. If it's negative, you double check it and then you're done. If there is a positive, you break it down either into smaller pools or individually for further testing.
So there are advantages, mostly cost savings. That's the huge advantage of pooling. Also, the ability to go through a very large volume of specimens.
Dr. Thomas Quinn worked in one of many labs that used the pooling technique during the HIV epidemic in the 80s. He says the difference between then and now is the tests themselves. Pooling dilutes the samples. The HIV tests were very accurate, so that wasn't an issue. But with COVID, the tests aren't as reliable. The other problem is pooling takes more time in the lab, even with robotic equipment helping.
we need to get everyone tested, and everyone wants to know what's the result of my test within 24 hours. That's very hard to do with pooling.
Dr. Quinn isn't recommending pooling for individual testing right now. He says it could be more useful in big surveys when it's not an emergency. Back to the lineup. As the number of COVID hotspots grows, we're looking at the likelihood of a second lockdown.
Nobody's preference to reinstitute the lockdowns. They're enormously disruptive. They're costly, to say the least.
What experts say we can watch for to see if a lockdown will be needed.
Keller and Keller.
The resurgence of COVID-19 in parts of the South as well as West are causing some states to pause and in some cases partially reverse their economic reopenings. Maya Rodriguez is looking into if the potential for lockdowns could be on the table again for some.
The coronavirus grip on the summer of 2020 is shaping up to mean different things to different people. Dr. Caitlin Rivers is an epidemiologist with the Johns Hopkins Center for Health Security.
The picture does look different depending on where you are looking in the country.
Only 2 states, Connecticut and Rhode Island, recorded a drop in coronavirus cases last week. In a dozen other states, cases are steady, including hard-hit New York and New Jersey, which got their number of COVID-19 cases under control. But in the other 36 states, the number of coronavirus cases is on the rise, including record-breaking numbers in Florida, Texas, Arizona, and Nevada. But Dr. Rivers says don't call it a second wave.
Most communities never left the first wave, and so it's difficult to call it a second wave.
But could a second wave of state lockdowns be on the horizon? Dr. Rivers says that would come down to a number of factors, the main one being hospital capacity.
Now, it's nobody's preference to reinstitute the lockdowns. They're enormously disruptive. They're costly, to say the least. It's a very difficult set of circumstances. So that's really for the worst case crisis situation. But we can't rule it out because we also cannot allow our healthcare systems to become overwhelmed.
That means keeping hospitals from reaching 90% capacity. Already, some states have paused their reopenings. In Arizona, Florida, and Texas, bars were ordered to shut down again because people were congregating without masks or social distancing, leading to virus outbreaks. But some medical experts warn more measures may be needed.
If we don't do something, and I mean really strong, containment, surveillance, contact tracing, and isolation, we're in for a very, very rough time.
In the meantime, much of the protection against the virus may be left in the hands of each individual.
All of us, including those of us who live in states that are not experiencing a lot of transmission, should be spending a little bit more time at home, skipping mass gatherings, for example, wearing fabric face masks when going out into the community, and doing a really great job of hand hygiene.
In other words, not letting your guard down while the virus remains out and about. In Washington, D.C., I'm Maya Rodriguez.
And our temperatures have been certainly on the warm side. We've had some of those downpours last couple of days, temporarily cooling things back. But today, not a lot of rain across central Indiana. We've got a temperature of 86 degrees in the city. The humidity has come down just a little bit as we've got that southeast breeze between 5 and 10 miles per hour. Tonight, our temperatures settling back middle to upper 60s across central Indiana. So not quite around that 70-degree mark, but still not a refreshing change as we go into the overnight. Thursday forecast does feature quite a bit of sunshine, so we're going to take out that daily chance for rain, and that's going to allow temperatures to once again climb around the 90-degree mark here. We'll be at 86 at noon, 90 for that afternoon temperature. And again, the humidity not quite as oppressive as it's been the last couple of days. Still certainly noticeable, though. With temperatures around 90 degrees, we'll have those heat index values in the lower 90s. And with lower rain chances, this area of high pressure is going to be building in, and that's just going to build the heat as we go right on into the upcoming holiday weekend for the 4th of July. And that means we're going to have temperatures in the 90s. Friday, 92, 93 on Saturday. Looks like both of those days will be dry right through the 4th of July for any plans there. And then on Sunday, 93 once again, just that isolated chance for a shower or storm. Dan?
Senate Democrats are unveiling a plan to extend additional unemployment benefits. This is for the extra $600 every week on top of what states already offer for unemployment. The new proposal would decrease the added benefit as the unemployment rate drops. The Economic Policy Institute supports that plan, saying the additional benefit should stay in place as long as needed.
People are really, really uncertain about how this is going to unfold over coming months. So putting some arbitrary end date on any provisions related to supporting the economy and the people in it during this crisis makes no sense.
They tell us the expansion makes a huge difference, not just for the individual, but for all of us. It estimates if it cuts off at the end of July, that could cost the U.S. 5 million jobs over the next year. That's because less spending creates a further drag on the economy. However, Republicans say the expanded benefit gives people a reason not to go back to work. Some studies have found the economy could actually be worse off if people don't get working again. The American Enterprise Institute agrees, saying the move was just meant to get through the initial lockdown.
This is becoming less of the pandemic caused us to initiate lockdowns and people are at home, and now it's just we have a large number of unemployed people. What should we do to assist them? And $600 addition to unemployment checks in a bad economy is a really unprecedented step.
The group says extending the benefits could set that precedent for Congress to act similarly for any future recessions. Let's start the news feed. Macy's is revealing just how hard it's been hit by the pandemic. The company says it lost nearly $3.5 billion in the first quarter. Last week, the company announced nearly 4,000 layoffs. And one of the largest franchisees of Pizza Hut has filed for Chapter 11 bankruptcy. NPC International has more than 1,200 Pizza Hut locations. It also operates around 400 Wendy's. And United is taking another step towards normalcy by adding nearly 25,000 flights back to its schedule. For perspective, this still only gets the flight schedule back to 40% of where it was last August. Meantime, the airline is calling out plans to block middle seats on planes. Today, the chief communications officer for United called it a PR strategy rather than a safety strategy. He says other safety measures on planes have more of an impact, including wearing a mask. Both United and American alert passengers when planes start filling up, and when available, let them switch to another flight. Delta, JetBlue, and Southwest have said they're blocking some seats. A few months ago, housing market experts were unsure how the real estate would rebound during the pandemic. But now, Alicia Nieves shows us they're not only surprised by the strong bounce back, but also by a new trend.
The housing market halted at the start of the coronavirus pandemic in the U.S., but now
housing economists have been optimistically surprised about the return of buyers to the market.
Economists like Skylar Olson with Zillow say this sector of the economy is seeing the strongest recovery.
A lot of properties that are coming on the market and having showings scheduled within a couple of days, and a lot of multiple offer situations.
Over the past few weeks, New York City area realtor Michelle Pfeffer has noticed not only a strong market, but a new trend. The most competitive sales are with homes like this one in the suburbs.
We're definitely seeing more people moving out of the city. We're getting people who've, been in quarantine for a couple of months now in small quarters and maybe have decided that it's more of a priority to have a yard and space.
Lingering uncertainty around the pandemic and a possible second round of closures and self-quarantines have motivated many of these moves.
I think that that's a big part of it, but also because we've had a big technological shift. Companies that weren't offering remote work options previously were sort of forced into it and found that it was effective, which means that they don't necessarily have to be in the office every day, and it gives them the opportunity to live in further distances.
New York City is so far one of 3 cities seeing the trend of a substantially higher number of people moving out of the city and into the suburbs, according to research by Zillow. The company is monitoring sales and home searches to see if this is a trend that will spread to other major cities or not.
This experience can bring a lot of changes to housing, but it's a little bit too early to see how it will actually net out. And you can imagine a lot of different ways that could play out.
I'm Alicia Nieves reporting.
One last check on the lineup. Messages are going around social media saying you have a COVID-19 tracking app on your phone now. We're clearing up the misinformation and finding out where that app really is in development.
Some people run in the best circles.
We're clearing up some rumors and misinformation regarding COVID tracking apps.
So what I think has alarmed people is that they get this notification about the new operating system and that it enables these apps. And I think there's a lot of confusion about what the status of that is. And so right now, no state has actually created an app and deployed an app that uses this Apple Google API.
What's happened so far is Google and Apple teamed up to create software that would allow a COVID tracking app to work. It was part of the newest software update on phones. It's not the actual app, so even if you turn the feature on, it's not going to work. States would be the only ones to develop COVID tracking apps, and so far only a handful have said they would. And when they do, it will be very different than what other countries have used with far more privacy protection.
Contact tracing apps was first released in Asia with a very different architecture, created kind of a bad reputation for these apps more generally. And what we found in our research is that the public doesn't really understand the differences between these different systems.
Sarah Krepp says because of confusion and mistrust, you would need a strong public education campaign to go along with the software. The Apple Google system would not use GPS to track your location. Tech companies and the government would not have access to personal information. People would willingly upload their positive COVID status, and then anyone that was determined to be in close proximity of that person that also had the app turned on would then be notified. And scam artists are going after the thousands of people looking for jobs during the pandemic. Tomorrow, we'll show you the most common ways they find victims and tell you what they often ask just before they take your money.
I'm not sure if you would consider it a lucky 7 in the 7-day forecast. It is certainly a hot one, though. We have got temperatures with highs in the 90s right through the middle of next week, and those rain chances gradually returning early next week. Thanks for joining us here at 5:30. The news at 6 starts right now.